Thank you very much. That was really inspiring. We'll open up the microphones now for questions, and I'll start while people are making their way to the microphones. We've often heard that change happens at the speed of trust. And I'm wondering if the two of you can describe how some successful practices for building that trust between health system, actually, interestingly, health systems and community. Can you describe some of those practices?
Sure. So I've had the fortune to be at the table of this work since the beginning and participated in those listening tours that Aisha mentioned. What I learned is it's one thing to show up in the room, like people are welcoming, they want to hear what you have to say. They may give you a little bit of a skepticism, a little bit of side eye, like, is this real? Or here we go again, it's the same thing. Like your job is to keep showing up. So if you make representations initially in that space, do what you say you're going to do, show up to their events, provide grant funding if it's in line with what you want to do, keep showing up. For me, the litmus test is I want to be invited to the barbecue. I want us to be in a space where you see me as a partner, not just the rich uncle. You see me as a partner in the work. And maybe about a year or so ago, I got an email from one of our community partners that was like, yeah, on Saturday we're throwing this community barbecue. We would love for Rush to show up. And I'm like, yes, because that's the ongoing relationship building.
Thank you. Aisha, other ideas?
I would say the building of the Community Advisory Council and giving them tangible things to do, having them serve as ambassadors for our target communities, seeing them and validating them as experts in their own experience and that they bring value has been key for us. It's also critical that they see people from their community in leadership for this particular work as well. So building bridges and making sure we're equitable in that way has been a win.
And Aisha is underselling. She grew up on the West Side in one of these neighborhoods that we're now looking to impact. And so having her in this role as, the leader of West Side United is huge. The other thing I would add on to that is I'm not really interested in quote unquote feedback from community. I'm interested in walking along the same path with community and sharing decision making. And so we didn't get into all of the 10 initiatives that we're working on with Westside United, but in each one of those, we have community residents at the table helping us make decisions. So if we're doing social impact investing, community residents are telling us, yes, that's a great investment. That will be really great for the community. This one, not so much, and this is why. And that is what shared leadership is really about, and that helps build trust. It's not just, I made up my mind and I want to hear what you have to say. It's help me lead this, give me your thoughts and we can make decisions together.
Excellent. Thank you. Horace.
Buenos días. Thank you so much for sharing your work. So this is a question. So you talked about getting community into the C-suite, and I would love to hear about getting the C-suite execs outside of the C-suite, the boardroom. You alluded to it by talking about catalyzing the workforce. You talked about your own personal, getting the phone call to the barbecue. But how do we get leadership into the community so that they can use their entire body as an, instrument of data collection, right? They can feel it, they can smell it, they can taste it. Thoughts?
I would say in us onboarding this new Community Advisory Council of 18 stakeholders, they represent all 10 communities. One of the things that we will do in their engagement is have C-suite folks come into those communities and attend and be intentional about, as Darlene said, not only coming to the barbecue, but having a presence. But in doing that, you have to be tactical and intentional and let it be organic so that it doesn't seem like it's being forced. So we're thinking through how to do that in the best way. We have community tours that we engage stakeholders in. So if we were in Chicago right now, we'd probably load you all up in the bus and go around to support these local communities, taste the cuisine, see the murals, touch the people, learn about key organizations there. We think is critical for our toolkit. So we just had a for our small business grant pool, a community info session where people come and learn about the grant, learn how to get technical support to apply. And so having leadership there in a room of 170 business owners is also a way for them to touch the work in another way and be able to advocate and take that back to the C-suite by being there and being present.
Yeah, and when community residents and folks ask you to come to stuff, show up. So we had a meeting last week with someone that runs a affordable housing community economic development institution, and he's like, yeah, so on Sunday we've got this rally. It's going to be like 400 residents, and we're going to be talking to the mayor about these 3 things. You all should come out. And then my boss, who's Senior Vice President of Community Health Equity, I get this text from him like, yeah, so I'm going to that rally. We need to like register, and he is in the C-suite. Okay. And so that's part of it. People ask you to show up, show up. Yeah. I mean, it goes a long way.
Thank you.
Thank you.
Jennifer Little from Klamath County, Oregon. Thank you so much. This is really, really amazing stuff you're doing, and I'm a little jealous. But my question, so we have a community advisory council specifically for our Medicaid provider locally, and what we found is we're trying to get them to be more comfortable going to the C-suite and talking with those people, but they have expressed that they don't feel qualified, they don't feel comfortable. So do you guys have like a training program or a something to help them, to train them and make them feel more comfortable and having those conversations?
Well, we try to engage them based on their level of expertise. So for Community Advisory Council, we have subcommittees around education, small business, and they plug themselves in based on where they feel comfortable quite naturally. But we are working with United Way to think through some of the things that they're doing around board development and diversity and implementing some trainings and possibly a fellowship for community members to help build that down. Because imposter syndrome is real. And so we really try to point out that they are experts in their own right, and bringing that to the table is just as much value.
Yeah. And too, like, when I think about the 18 members that are on the advisory council, there aren't a lot of shrinking violets. Like, we selected people, I mean, really, like, we selected people, we were just talking about them yesterday, that's like, gonna really push us and hold us accountable. And those are the folks, I can't wait for this, like, initial, like, joint meeting with health executives and then these community leaders, because our health executives have a lot to learn from the community leaders. And vice versa. So they're not shrinking violets at all. And there was one other point that just escaped me. If it comes back to me, I'll raise it.
Thank you. Mark.
Thanks, Mark Aravich, NYU and the Roundtable. So a deep sense of mission and vision at the organization, at the institutional level, can go a tremendous way. And I think that's one of the many things we're seeing here. What crystallized that? What happened in 2015? Because that's not happening at all institutions around the country, and so I guess I'm curious about that story, and then also sort of related, what would the board's assessment of its impact on the bottom line in 2019 or 2020 of this direction be?
So I think a couple of things happened. One, I showed the slide with the Chicago Transit Authority and that gap, and so that map was shown to the board of directors for Rush, and there was a call to action. What are we going to do about this? So that was one catalyst, and another catalyst is my boss, Dr. David Ansel, was in the process of writing a book called The Death Gap. That talked about the disparities that exist between Chicago and the West Side. And he's worked on the West Side for the last 40 years in safety net institutions, and then obviously most recently at Rush. And so his kind of dogma and having enough credibility within the C-suite and across Rush also became a catalyst. So I would say the data and then the personal like drive for it. And then you asked about bottom line for the board, right? And so I went to law school to avoid math, but but I have to work with our CFO, CIO, who like has his math hat on, and they're excited about the social impact investing component because we're putting dollars in, like $4.5 million to date, but we're getting a return on that investment. And like someone else said on an earlier panel, they're excited about being able to reduce emergency room visits. We did a scan to see who was coming to use resources at Rush, and they're from the communities that we're talking about. So it is that, yes, benevolence, this is the right thing to do, coupled with trying to be smart around the finances.
Great. Please.
Hi, I'm Ray Baxter from the Blue Shield of California Foundation, and before that, Kaiser Permanente for many years. The question I have for you is about organized labor. There was a time when labor played a critical role around equity and protecting people's rights and investing in communities and some forth. And I believe you're in a community that still has unions. Are the labor organizations of the hospitals engaged in, supportive of, not engaged in the work you're doing? It seems like there are a lot of potential touch points here, but I'm just curious about that, if you could talk about that.
Yeah, that's a great question. And so we have a couple of employee pathways that impact some of the labor unions that are there at Rush. And we have worked hand in hand with them. Like, this is the idea that we have. How would it affect your members? How can we, work together? They want to see opportunities for their folks just like we do. But we also recognize that we can't just put something together without engaging them. So yes, like I can only speak for Rush. I don't know what the other hospitals are doing with their unions, but we have engaged them in that way before launching any kind of program. So far, so good.
Thank you.
Consuelo Wilkins, Vanderbilt and Meharry. It's kind of tight for me, sorry. I wanted to speak to the question earlier about getting community members to the C-suite, just to say that it's important also to provide some orientation and set expectations on the C-suite side. And that may not be as important at Rush because there's such great buy-in in the C-suite, but we have found that we have to sort of set rules and make sure that they understand why people are coming in, what their expertise is, and sort of framing their lived experience. And sometimes we have to tell them how to be nice, which may not seem like it should be necessary, but if you've worked in academia in particular, you know that we're not always nice to each other. So, some of the things, like the way we just, treat each other is just, like, do it now, don't speak, don't greet each other in the room. So sometimes you have to set that stage. So I just wanted to put that out there as well. And usually we have the leader of the meeting say those things, not those of us who are bringing people to the room. So we coach the chair to say, this is what you have to say, so that it's coming from them and not us. But I did want to ask, and we spent quite a bit of time with the Rush team a few months ago, sort of trying to understand how they've been successful. And one of the things that struck me, which you, Darlene, went by quickly on your diagram, is the talent acquisition, or maybe it was you, Aisha, but the talent acquisition piece. And I think that's part of the changing culture, is like you have things set up and you're working with the community and you develop these great job descriptions that sort of strip all these, qualifications that don't really matter, and to really get a great pool of candidates to the table. But then the hiring managers are sort of saying, well, they have a GED and not a high school degree, or they don't have this degree, and did you say they'd been arrested before? Yeah. And so some of those things. So I don't know if you can talk about how you're changing the culture around those things.
Absolutely. And I'm glad that you raised that, because one, this has been work that's been going on just for the last 3 years. And so we have a lot to learn. Like, we figured some stuff out, but there are other things that we need to figure out. And one is, like, what are those institutional, internal barriers that can derail the work? Because it's one thing for folks in the C-suite to be like, health equity, this is a great idea. But then I'm asking HR to look at the way they do things differently. Then I'm asking them to take off their own implicit bias hat and do things differently. And so I think one of the things that will help toward changing the culture is to pair this work with our diversity and inclusion trainings work that we're also doing at the same time. Because you're right, like, we'll bring in amazing candidates and there might be, a comma or a period that's moved out of place on a resume, and they're like, well, wait a minute. And then that requires their manager to have conversations with them, or the recruiting staff from HR to have conversations with them. So yes, like, there's some internal training that needs to continue to happen, but I think if we pair our health equity work with our D&I strategies, then we're on the road to changing the culture.
I'll say what we've done to date is bring those hiring managers together. So they're part of a working group that is tasked with not only helping us achieve local hiring goals, but to Darlene's point, to think about ways that we can shift policy in a universal way that allows us to be successful.
So hiring managers across institutions.
Yes, across our 6 institutions.
Oh, impressive.
Sandy Magnan. So you guys are just so inspiring about getting on this path upstream. If you were going to advise someone, thinking, well, we want to do something like that, what would you say has been the biggest controversy or issue you've had to face? And then what do you see coming down the pike as far as you sound like you're in a wonderful place now, but what's the next tension or controversy or thing that you say we're going to need to navigate? So what did you navigate in the past that you tell someone, and here's how we did it, and then what do you see coming down the pike?
I'll start there. I would say with our goal of decreasing this life expectancy gap by 2030 in these communities, one thing that we always hear when we talk with community members is that this is great, this is amazing, but will I be able to afford to live here by 2030? Will I be here? So for us, it's around thinking through housing and we heard in North Carolina the number of folks that are displaced in this national issue. So for us, it's really drilling down on how we're intentional about reaching that is something that we want to pay attention to. And I think some of the success of this work has been rooted in the health institutions' intentionality and honesty about naming the role that they've played in this disparity, claiming it, and then working to reframe it with community being there. I think having a quarterback or a champion like Dr. David Ansel, who's reputable, who can bring folks to the table to start thinking differently, as well as tapping into community power, and bringing additional resources from different sectors. We've been blessed. You talked about our secret sauce earlier, with working with entities like the Civic Consulting Alliance, who have an army of resources that help us build things a little faster. In my world, previously to coming here, I was working for a small nonprofit, and what we've done in the last 3 years would have taken us 10 years to do. So it's about the capacity building, who you have at the table, and then thinking through that.
And for clarity's sake, when she talks about the Civic Consulting Alliance, they work on public-private partnerships, and they are consultants, so they're bringing in people to help you project manage stuff. Mm-hmm. So they're bringing folks around the table, setting agendas, and kind of keeping that meeting cadence going. So like we always talk about how, my job takes up 100% of my time. Now I got to do this health equity stuff, and where am I going to find the time to do it? Well, having Civic Consulting Alliance, like, they're helping us do that. So, it's like a divide and conquer. But back to your question, what keeps me up at night is sustainability. Like, I'm interested in how do we move health equity from being the buzzword of now to a systemic thing that is just a part of the culture and a part of the work. That's what concerns me, and I get concerned about the funding for it too. So right now, things like Anchor Mission and Westside United, we're the nice, bright, shiny thing. And so funders are like, we're interested in this work. how does that look 5 years from now? And what are the things that we need to do now to lay the groundwork for when they're on to some other new shiny thing? So those two things. And then lastly, I just want to say, you can put information up on a slide and it looks all lovely and great and all that, but this is hard. This is hard work. It's hard with our institutional partners when we're talking about who gets credit for this and you all are trying to do that, So it's hard, bringing institutions that were previously competitors together to work. We've been doing well, but it's a lot of work. And then it's also hard with getting that buy-in from our community members and constantly having to keep the relationship building going. And so those are the things that I'm constantly thinking about.
Thank you.
So we have just a couple minutes, but I just wanted to follow up on your comment about how hard it is. It truly is exhausting, and the metrics that we're looking at are metrics that you're talking about 2030. I mean, this is a long time from now. I probably won't be here, but how do you keep the momentum? How do you keep people encouraged? How do you keep the enthusiasm? You guys are so inspiring to sit next to and to be vitalized. I feel like I can go back home and get going again, but how do you take care of yourselves, and then how do you take care of those organizations that you're working with?
Well, we just got excited yesterday about this new app that Rush has accepted that's all around yoga and meditation. So self-care is something that's very, as Darlene said, working with external, internal partners, and just the whole scope of this audacious goal can be intimidating, but because I'm from these communities, it's part of my personal mission. I see it as a privilege and an honor to serve. And so I think everybody that's attached to the work has found a connecting point, and that's an important driver. Just the mission of Westside United resonates with our stakeholders. And so for me, that's something that I see that's continual. And when we break bread, when we're in meetings, that's something that we thrive off of.
Yeah. And just to add on that, so I'm a civil rights lawyer by training. So being in this social justice, civil rights space, I've been here for 25 years. It don't look like it, but I've been here for 25 years. And so when I come into health institutions, I almost feel like an interloper. And then I'm like, what took y'all so long? Why? Social determinants of health, of course that affects, So just knowing that people are we should be doing something about this keeps me going. And to your point, my personal purpose is to serve. And I'm fortunate enough to work somewhere that's and we'll give you resources to do it, so that's a blessing.
Well, Chicago's lucky to have both of you. So join me in thanking Darlene and Aisha.